Welcome back to the Arizona Daily Mix as we've been talking a new year, a new you, and this is something that's not new that I've been doing, and that is IV drips. And I'll be honest, I hate needles. This doctor knows how much I hate needles. It's Dr. McGee. Good morning, doctor. How are you?
Good morning, Brad. How are you?
And so, okay, you're here in Arizona, and I'll tell you right now, there's been a very few people around the world that's able to stick me with a needle, and literally, you're the number 2 person. Uh,
Oh.
yes, and so before we get into our interview, tell people how scared I am because am I scared of needles or?
You're not that bad, Brad. You're actually quite all right, and it's natural to have a fear of needles. I always tell patients, if you like being stuck with a needle, a condition I cannot treat you for. So a natural fear is okay, and you do quite well each and every time. So no
Yes.
issues there for you.
I will say that, I do a lot of hand holding there, and I think I broke
Yes.
the person's hand that you had to bring someone else in to hold my hand when I do the needle. I think they avoid me when I come to the office now. They don't want to
If
hold
anything,
my hand.
we have several people in office to help hold your hand. We'll rotate them in.
So, all right, speaking of that, we're talking IV drips that we know people were doing in 2020, especially with COVID and the pandemic. I've been using it to make sure I'm getting the proper vitamins in me. And so before we get into ozone therapy, let's talk about IV drips because a lot of people have questions about them. Are they good? Are they bad? I find them very, very healthy for me. And even though I got to do the needle, it's still pretty much a painless and easy thing to do, right?
Very much so. It's been around for over 30 years, very healthy therapy for patients wanting to stay healthy during this time. If they have acute or chronic conditions as well, you're doing a good dose of vitamins like vitamin C, B complex, B12, zinc, along with the hydration of the saline bags. So here in Arizona, we want to make sure all our patients are getting a good base of those vitamins and minerals, along with keeping their hydration up.
Yeah, and you said right there, hydration is so important. And even though we might drink enough water, we might be taking the vitamins, it's still just a little extra to help us there, right?
Exactly. We think we're drinking enough water. It's due to, hey, I got a bottle in today, I need a bottle tomorrow, but we actually drink at least half our body weight in ounces of water. And the saline bags are about 2 water bottles without having to drink it. So if you're able to do an IV therapy, that's a great way to get your hydration status up.
Oh, I like it. Okay, now let's talk this ozone therapy. What is ozone therapy? It was kind of interesting when I saw that you guys had brought this on, and then I started to see articles about it. What does this do?
So ozone therapy is utilizing ozone gas introduced into the body through the bloodstream, similar to the IV therapy, and we're helping to increase oxygen in the body, along with help the immune system, along with decreasing inflammation in the body as well. So the overall effects are wonderful for patients, and they do feel the effects for several days, if not weeks, after their treatment.
Yeah, that's one thing I wanted to know, how long this does last. You just said it right there, it lasts a little time, because I think some people think that you just get a drip and that's it and you're done, and you got to keep going back and back. So it just takes effect really good, right?
Exactly. Several treatments are recommended since a lot of patients are deficient in vitamins and minerals, along with have a lot of inflammation in their body. So one treatment's not going to do it, but several treatments are recommended to help decrease inflammation more and more each treatment that you do.
So, all right, the benefits of this is going to help me if I'm working out, or if I'm recovering, or if I have been a little sick. Does that where these benefits come in?
Definitely. We do have a lot of patients that work out a lot, they're hiking, they're getting out in the elements, and increasing oxygen in the body helps for the repair and recovery from those strenuous exercises, along with the immune system is stimulated to help fight off any pathogens like bacteria, fungus, virus, parasites, and helps to immune modulate as well for those people with autoimmune diseases. So the overall effects are wonderful for each patient.
So I like what you said, that you said people who might have autoimmune system problems. Is that what did I say it right? So
Autoimmune, yes.
And so are those the proper candidates for these kind of treatments, or who should be getting these treatments?
It's everyone should be getting these treatments, even if you're just a healthy individual. There's no side effects to these treatments. In fact, they're used in conjunction with other medications and therapies. So there's no interaction in any sort when it comes to acute or chronic conditions, autoimmune diseases, especially when it comes to keep yourself healthy during this pandemic.
Yeah. All right. So will this oxygen therapy help like a little bit more in recovery? I had a friend who took a spill on their bike and hurt their ankle. Will this help out a little bit?
It helps immensely. They can do either IV therapy with the ozone as well as an injection therapy with the ozone as well to help repair tendons and ligaments, help with decreasing the inflammation, the swelling, reduce the pain because it works on the nerve endings as well. The ozone therapy I use in the office for IV therapy as well as injection therapy for pain and acute strains and sprains.
I like it. I know we're going to be wrapping up here in just a second, but one thing I want really quick, tell them your background because they have to understand you are a doctor, you know what you're doing here, and that's where you want people to understand. You want to go to this like someone like you, not someone who's like in their house and has, you know, a couple IV drips that they've learned in, you know, YouTube videos.
Exactly. I am a naturopathic medical doctor. I've been trained in IV therapy and ozone therapy over 6 years now, doing quite a bit of research on my own, as well as reading research from here in the U.S. and in Russia, UK. There's a lot of information out there, but a certified medical professional is where you want to go to for your IV therapy and ozone therapy each and every time.
So I like it. I know I'm going to have you do some plugging, but I got to plug that this also comes with a membership at Arizona Plastic Facial, which I like that you can actually get into a membership, which is really good. But I know they offer some other great things there. Very quick, tell them the website to find out more about, of course, the IV drips, the ozone therapy, and everything that Arizona Facial Plastic has to offer.
Sure, you can find us at arizonafacialplastics.com, and on there you have our IV therapy, ozone therapy, along with the Botox treatments, fillers, laser treatments. We also have Dr. Tahizadeh here in office. That is our facial plastic surgeon. So you have your facelifts, neck lifts, along with other head and neck surgeries we have in the office. So these are two.
Gosh, there's a lot going on there. So I just go in for the IV and this beauty right here. That's it right there. So Dr. McGee, thanks for joining us. And again, I'll see you probably next week to get my needles. Hopefully I have someone to hold my hand. We'll see what happens.
You can look forward to it. We'll be ready for you.